Dr. Sharfstein, a lot of people are sick of hearing about COVID. They want this to be over, and frankly, they're acting like it. I mean, Macron, Putin might have been at a table 20 feet away, but certainly people in bars are not, and you see that across the nation. How much are we heading toward a 1918 flu pandemic fourth wave that nobody talks about, where people do get sick, people do die, but nobody wants to hear about it because people have already moved on?
Well, I think there's this cartoon of people, in a crowded restaurant saying, like, I can't believe we can't get back to our lives yet. There are people who are still, doing the things that they were doing before and complaining that other people are being extra careful for themselves. And, I hope that we can come to a bit more of a consensus, a little bit more of a consensus. I realize it's hard that, we should be watching that wave come down and scaling up our activities on the other side, and not just throwing caution to the winds. If you go back to the beginning of this pandemic, every time the curve goes down, people go like, I'm so glad it's over. Well, and it's just like, how many times we have to learn this lesson. We will, and we are doing a lot more than we have before. We just have to, be thoughtful about it.
Well, but Joshua, people point to the ratio of hospitalizations and deaths to the number of cases, and that ratio has declined. If you look at the number of actual deaths, it's declined dramatically versus the people who actually contract the virus. At what point is that a determining feature, that basically this is like the flu, or it gets down to an illness that really is routine for people rather than something that has a much greater mortality rate?
Yeah, well, it's probably around the time that the mortality gets to that point, but we're still at 2,400 deaths a day. So, that's not today, but it's not unimaginable. And I think it's, we're seeing that countries that are very highly vaccinated have been able to withstand the Omicron wave without nearly as many deaths as we've had. We're building, obviously, between the vaccines and infections, a lot of immunity. So I do think that we will get there, and we just have to, watch the indices and take smart steps along the way. I just think that we're just going to prolong this tail if we're not able to find some ability to, have a reasonable approach to the virus for the next at least few weeks, if not months.
It's been almost the exclusive focus of the healthcare industry community for the last 2 years now, Doctor. And as you know, there are other issues that are becoming a bigger concern, particularly for young children with speech development delayed. You can think of the psychological issues as well. Just how big is the hangover going to be, sir, for you and for others working in the industry for the next several years, maybe even longer?
I agree that there's going to be an enormous shadow cast by the pandemic. And I'm a pediatrician. From children's perspective, what's happened with their education is huge. Many kids have fallen behind on their own immunizations. It is going to be an enormous catch-up period. And that's why I think it's very, very important for this country to invest in kids. They have sacrificed, in many cases, for the greater good, for the good of adults who are much more vulnerable to serious illness. And we owe them a lot. I'd like to see that child tax credit extended, for example.